Bismillah ar-Rahman ar-Rahim. Assalamu alaikum everyone. I hope all of you are doing very well. I'm sorry about the confusion of the assignment last week, but there were a few things that I needed to clear, and I wanted to make sure that you have enough material and enough detail to do well on the assignment, of course, if you want to. What did we learn so far? Remember, we're talking about evidence-based physical therapy, and historically, both medicine in general and physical therapy in particular made clinical decisions based on anecdotal evidence, which means روايات, or based on an expert opinion or what we've learned in school. Some people also practice to minimize cost, so they did whatever is going to cost a lot of money. Evidence-based medicine and evidence-based physical therapy is now expected as the standard of practice of each profession. So basically, la mafar. If you want to practice the profession, the standard that is expected is evidence-based practice and evidence-based standards. How do we start? If you remember last time, we said we start by, to find the evidence, we have to start by a well-articulated clinical question. And the question must have the 4 parts summarized in the acronym PICO, and we applied this acronym to an example. Searching for evidence, as we talked, can result in hundreds and hundreds of articles and hundreds of resources. And not all resources are created equal. Some resources are more valuable than others, and we talked about the hierarchy of evidence and the fact that systematic analysis and meta-analysis and experimental randomized controlled trials are much more valuable as evidence than, for example, a case study. So evidence is not all equal. Some evidence is more valuable than other evidence. So let's talk about the assignment that I wanted you to do. So assignment number 1A, which means that there will be number 1B and number 1C, because there will be just 2 assignments through the course, and each assignment will have different sections. I have a case study. It's a neurological case study, Parkinson's disease, and I wanted to read with you the study before you do the assignment to make sure that you understand the detail. This is Mr. Charles Peabody. Of course, that's not a real name, but Mr. Charles is a 72-year-old man with a history of Parkinson's disease for 15 years. He takes Sinemet. As you all know, probably, the Sinemet is a common medication for people with Parkinson's disease, but continues to have symptoms, so the medication is not enough for him, or not getting the results. Mr. Peabody does not experience bradykinesia or rigidity while medicated. He has functioned at a I don't know if you're familiar with this staging process for Parkinson's disease, but in general it means that he has mild bilateral disease with recovery on the PUL test. Until recently, when he began falling. So he was doing well until he began falling. He sustained a mild concussion of the brain after his latest fall. So he started to fall. And when he fell last time, he hit his head and he had a concussion on the concrete driveway. Mr. Peabody is afraid to ambulate now, and he has begun to functionally decline because he's not walking. He does not attend his bridge club or do his own shopping. His doctor referred Mr. Peabody to physical therapy for a gait and balance consultation. So imagine in your clinic that this is your patient with Parkinson's disease. He is taking Sinemet, and he was doing okay with some symptoms until he started falling. When he started falling, his last fall resulted in concussion. And now the doctor would like you to suggest what to do with this patient. Upon your initial evaluation of the patient, you discovered that Mr. Peabody falls primarily when he freezes, causing him to fall forward. So when he's walking, he freezes and he falls forward. He has tried using a walker during these off times, but he stopped once he fell forward onto his walker and sustained a bad rib bruise. So his frequent falls resulted in many injuries to the point that the patient is refusing to use his walker anymore and walk. His Berg Balance Scale score, I don't know if you're familiar with the Berg Balance Scale, but it is a list of activities that the patient can do, and you grade each activity from 0 to 4. The maximum score on the Berg Balance Scale is 56. Mr. Peabody scored 38. 38 is less than the 45 points cutoff for fall risk. So everyone who has 45 out of 56 is at risk for falls. His timed up and go is 32 seconds. Timed up and go is another test I'm sure you're familiar with. He takes 32 seconds to do the timed up and go, and 10 seconds is considered normal, which means that he takes longer to do the test. Ultimately, Mr. Peabody would like to return to his previous social and community activity. So this is the goal of the patient. He would like to go back to his bridge club and to his community activity. Now, the issue here is that you have this patient and you need to determine the best method to teach Mr. Peabody how to manage his freezing episodes instead of falling forward, of course, thus allowing him to decrease his fall risk and increase his ambulation activities. The therapist is somewhat familiar with the use of auditory and visual cues to manage freezing. Those of you who are treating patients with Parkinson's all the time, you know that you can use auditory cues or visual cues to manage the freezing episode. But this therapist that we have, or you, can't remember which is more effective, to give auditory cues, meaning to tell the patient what to do, or to use visual cues to train the patient. So you are in your clinic, you have this patient, and you know that there are two ways of doing things, and you are not sure which way is going to work with this patient. The old tradition is that we try this, and if it doesn't work, we try the other one. Now we cannot do that. Now we are in evidence-based profession. We need to know which one will work better, and we need to use that one, and we need to be able to defend our choice in front of anybody, including a court of law, that we have picked this treatment because we know of the evidence that supports this treatment. So your answer, the answer, will be on the PICO scale. So what I would like you to do to answer the question for this patient, what is the specific question that you are going to ask? And I want you to fill in for each letter of PICO. Okay, so that's number one. So assignment number 1A, I would like you to put the parts of the question in this format. And again, now you have been divided into groups, and each group needs to submit a separate form that has this answer. Okay, so this is the A section of assignment number 1. And we'll talk about the B section shortly. What I would like to do, because I'm going to start to ask you to go to the literature, I'm going to start to ask you to go to different databases and to look for articles. So before I do that, I would like to remind you what you are going to find in the article, because this is important to remember. I know that many of you probably know this, but I want to make sure that you remember all the detail so you can do well on the assignments, as well as we can proceed faster, because we're really starting very slow, but I want to make sure that I'm communicating properly and you're able to get the lectures properly and everything is going smoothly before we go full speed. So what we're looking for when we talk about evidence, we are looking for peer-reviewed scientific articles or peer-reviewed scientific journals. What does this mean in Arabic or in English? It means that I am looking for articles that has been reviewed by experts in the field of the topic of this article. So to make sure that this article has a critical substance that is appropriate and is fitting for publication. Okay, so we're looking for peer-reviewed scientific articles. How do these articles look like? You are familiar with this. Any scientific article, most of scientific articles, I should say, because some are a little different. But if it is an experimental study, the components must have an abstract. Of course, it has a title, it has an abstract, an introduction, methods section, results section, discussion section, and the references. The abstract section summarizes the question being investigated in the paper. So if you read the abstract, you will get a summary of the question of the study, what did they do to answer the question, the results, and the conclusion. The abstract is different from the summary. The abstract has all the components of the paper. The summary at the end might not have the methods of the study. The abstract is very useful for you, especially in the beginning, because it will help you determine if this study fits what you're looking for or not. So from the very beginning, when you read the title of the study and you think it's useful, you need to read the abstract to decide how useful the study is. Sometimes you read the title and then when you read the abstract, you decide that this article doesn't really fit my question. No researcher writes the abstract first, although it appears in the journal first, but it's usually the last thing that's written. Remember, the abstract has the results and the conclusion, so obviously you must finish the study and write the study, and then you can write the abstract. The introduction section, in this section, the author or the authors, they try to introduce the problem and questions by addressing previous work. So the introduction section, you will see that the authors reviewed many studies related to the topic, and they decide that these studies are missing something. And this thing is the topic of the current study, and this is the purpose for the study. So every scientific article will have the introduction section, which is really setting the stage for the current study. So what do we expect from the introduction? We expect to see a summary of the work that was done previous to the current study, the study at hand, and to comment on what's missing from these studies and why the author is decided to do his or her study. Okay? The method and material section, this is very important. It could be called methods, it could be called methods and materials, or materials and methods, depending on the journal. In the method section, it will tell you every little thing about conducting the study. If the methods are written correctly, appropriately, anyone can repeat the study. So if I read an article and if it is written well, I should be able to get the same results if I follow the same methods. My error margin would be very small. But if the methods are not written clearly, and if it's missing something, then repeating the study is going to be difficult. Under the methods and materials, the author should talk about subjects. How many people or animals or books or laptops or whatever the study might include that the researchers are using in the study. So if you're choosing 50 people, how many men and how many women, and what are the characteristics of these people? Are you taking children, older adults, how old, how many men and how many women? How did you get these people? Did you pay them? Did you advertise in the newspaper? Did you advertise in a hospital? Did you advertise in class? How did you recruit these subjects? So this is all under subjects. Then comes the instruments. The instruments that you're going to use. Are you going to use blood pressure cuffs? Are you going to use an isokinetic machine, a goniometer? Whatever you might use should be under instruments and should be written clearly, and the manufacturer should be mentioned. So if I have a Cybex or a Lido or a Kingcom, I have to say the name of the company that is associated with this instrument. In the procedure is basically step by step. Once the patient or the subject enters the door, what are you going to do with this patient step by step? So this is what the place where the author is going to tell you that the patient walked into the door. I had the patient sign a consent form, and then I measured his blood pressure and his temperature, and then I explained the study to him, and so on. So this is the place that if you want to repeat the study, this is the place to see the protocol of the study. Data processing and data analysis are very important. For example, if you're doing an EMG study, you will need to process the data first, and then you need to analyze it statistically. This is a place where many authors might miss something or might analyze the data in an inappropriate way. So when you review an article, when you're reading an article, you should be able to know if the authors have processed and analyzed the data properly. How did the authors set up set up the experiment, your experiment or their experiment? How many experimental groups did they have? How did they measure the effect of the intervention? And these are the outcome measures. So, for example, if I have a two groups and I used one group as a control group, the other group as a experimental group, then I used an intervention of some sort, whether the intervention is like some sort of electrotherapy or manual therapy or gait training, whatever it might be. What are the outcome measures that will tell me if my intervention worked or not? So outcome measures is a very important part of your method section. So for us to understand any study in a journal, what did the authors do? We need to go to this section, which is the methods and materials. The results section, here the authors presented the data that collected. The results are usually shown in tables or graphs. You'll see a lot of tables and a lot of graphs. Many journals demand that all figures and graphs that are presented must have a caption or title to make it stand alone, and they should be. Tables and figures should stand alone. If I open any article and look at the figure, I should understand it without reading the whole article. That's the standard. Every title of every table and every graph should give me enough information to understand it. The discussion section is extremely important. In this section, the authors try to really tell you how their data compare to other people's data. Did the data support the hypothesis that the writer or the authors hypothesized in the first place? Were they able to answer the questions that they asked in the beginning of the study? Also, after every study, there will be remaining questions that were not answered, and this is where you can find actually a question for research is when people do a study and then they come at the end of the discussion section and they say, however, our study doesn't answer this question, although it answered those two questions, and further study is needed. So this is another section that is very important for the reader. The references, you will see a list of all cited work. This is a good place to find other studies that are related to the topic. Usually the references are must be in a specific reference style that is adopted by the journal. Some journals use the APA reference style, some journals use the AMA reference style, and you will be practicing this in your assignment today. All right, so we get to assignment number 1B. And this assignment is, again, important for you to practice before we start to go into databases and how to search different databases. So assignment number 1B, for each group will choose an article that addresses an experimental study in any field of physical therapy. So if the group is interested in ortho cases, they might choose an article that addresses an ortho case. For example, if you want to address anterior cruciate ligament, but please, the article has to be either 2014 or 2015. Okay, and you will find many articles. If you're interested in neuro cases, that's fine. any article that you feel is addressing something that you're interested in. I would like recent articles. If you can't find a recent article on the topic that you're interested in, let me know, and I can give you permission to go to 2013 or 2012. After you find the article, please give the full citation of the article following the AMA style of references. I gave you a website that has the AMA style and tells you exactly how to cite an article in that format. This is very important. You must follow the AMA style. Then you're going to answer the questions that I will discuss right now. And you want to make sure to submit your group number and the citation before your answers. So for every group now, there is an assignment 1A, and that will be separate. Assignment 1B, again, the group number, the name of the assignment, and then you start with the citation, and then you answer the following questions. The answers should not take more than 5 pages maximum. I really would like succinct and short answers, not an essay for every question. You must check the spelling to make sure that you have no typos. Typos are not acceptable. We have spell check, and you can check your spelling. Don't give me something that is that has typos, please. So assignment 1A and 1B are due on Thursday, May 14. So you have 2 weeks to do this assignment, and I think that's plenty of time. All right, what are the questions? Before I get to the questions, I wanted to show you an article, and I'll give you this article. This is an old article. It's mine because I am familiar with the topic. I can go through it very fast. So this is, I'll post this article for you as well. So this is the title of the study. So synergy of medial and lateral hamstrings at 3 positions of tibial rotation during maximum isometric knee flexion. So this is the title of the study. Names of the authors, the affiliation of each author, where do these people work, and then this is the abstract. The abstract will set the stage first, why the study was done. For example, it says rotation of the knee has been used to isolate the strength of the medial and lateral hamstrings during manual testing of the knee flexors. The purpose of this study, and this is very important, the purpose of this study. So here the author is telling you why they did the study. So the purpose of this study was to determine if medial and lateral rotation of the knee during manual knee flexor strength testing increased the electromyographic activity of the respective hamstrings. So basically it's saying if I rotate the knee medially or laterally, would that change the electromyographic activity of the medial and lateral hamstrings? And then here is the subjects, 23 women between the age of 22 and 36. So in the abstract, it tells you about the age of the subjects. Characteristics of subjects, they're young and they have no history of injury or disease. So this again is important to know that these people don't have any pathology. Then, and this is part of methods again, remember in methods we want subjects and then instruments. So I'm talking about the instruments now. Indwelling fine wire electrodes were used to record the activity of semitendinosus. and semimembranosus on the medial side, as well as the lateral, the long and short head of the biceps on the lateral side. Okay? During what? During maximum resisted flexion of medial and lateral with medial and lateral rotation of the knee. Now, so now I told you the purpose of the study. I told you how many people. I told you the characteristics of these people. I told you the instruments that I used. And of course, the outcome measures here is the EMG activity, right? In the different positions. Now, what kind of statistical analysis did I use? I used something called repeated measures analysis of variance with post hoc Bonferroni adjustment. It doesn't matter if you're not familiar with all the terms, but it means that I applied statistics on the EMG activity. And now I'm giving you the results. EMG activity increased significantly for lateral hamstrings during ipsilateral rotation, and I give you the p-value, which is less than 0.05. This is your error, less than 0.05. And I continue with that the semitendinosus had mean activity of 109% of maximum during medial rotation as opposed to 95% of maximum during lateral rotation. So all of this is results. And I talk about semimembranosus, and I talk about the lateral heads, the long and short head of the heads of the biceps. And then at the end, I'm giving you the conclusion. Even though the differences are statistically significant, they ranged from 2 to 13% of maximum activity. So the clinical importance of the change in activity between medial and lateral rotation is questionable. So I'm basically saying that although it was a statistically significant the difference was statistically significant with p less than 0.05, but the difference was only 2 to 13%. So what I'm saying is I'm not sure that this difference is clinically significant. So although it is statistically significant, I'm not sure that it is clinically significant. Okay? Here is a very important part that I would like you to pay attention to, and these are the keywords. So if you want to search for my study or similar studies, these are the keywords that can help you, and this is how you are going to search after you decide on your article this time. That's how you are going to research about your study using keywords. Okay, this is the introduction of the study, and remember, introduction means I'm trying to say who did what in that. Most journals will not have introduction and literature review or review of the literature. Most journals will have only one piece, which is the introduction. So in the introduction, I'm talking about previous work. What did people do? If you notice here, I am putting the numbers in parentheses, these brackets. Oops. Because this is what the journal told me to do. Every journal has different way of referencing. So this is important to follow. Otherwise, the journal will not accept your article. Okay, the methods section, and this journal wanted just the methods section, and now not materials and methods, now subjects. So method section is 3. So 3.1 is subjects, as we talked. 3 to instrumentation. In instrumentation, remember, we describe exactly what we've used and the specs of each piece of instrument. I'm here describing the telemetry system. It's FM telemetry to a DEC 1123 computer. The computer sampled each channel at 2500 hertz. The modulation of each channel was adjusted to ensure 100 to 1000 hertz frequency response with an overall gain of 1000. So everything about the instruments, calibration, how did I calibrate the machine? Do I know that the machine is calibrated every time I use it? How did I process the data? Digitization of the data was accomplished with an aid of a DEC 1123 microcomputer or mini computer with an A to D converter. All AMG data was digitized at 2500 samples per second. Then comes the procedure, and this is really what I did with every single patient. Since they arrived, where did they arrive? And I'm here saying that all testing was done at the Pathokinesiology Laboratory, Rancho Los Amigos National Rehabilitation Center. How did I sterilize the needles? What did I do to insert the needles? How did I know that the needles are inserted in the right place? All of this is written here. So when you want to know this information, you go to the procedure of the study. Okay. Results, data analysis, all statistical procedures were performed with BMDP statistical software. That's what I was using at that time. I used repeated measures and analysis of variance, and I used post hoc testing. Results, again, describe exactly the results. Graphs. Each graph has a title and a legend. In the legend, I have figure 1, what it is showing. Abbreviations must be spelled out. I shouldn't come to this table and see these abbreviations. I don't know. I have to go back to the article. A good article must have all abbreviations under the figure, so people don't have to go and search for the meaning of these abbreviations. Okay, and then in the discussion, this is the section where the authors are going to discuss the results that they got. How does it compare to the rest of the world? What does it mean? So up to here, I'm telling you it's different or not different, and this way give this much and this way give this much. But really, what does that mean clinically? And the discussion is the place where you see that. Some journals require conclusion, and this is a good place to look if you're not sure about your understanding of the study. And of course, the references at the end. So I will post this article for you to kind of make sure that you remember where to find things, because when you look for evidence, you need to go to the places, otherwise you're going to waste a lot of time. You need to know where to look for what. So if you're looking for a question, an answer to a question that's related to the instrumentation, you probably need to go directly to the instruments under methods to find it. If you're looking for specific results of intervention, maybe you want to go to results. So you need to know where things are so you can find the answers quickly. Okay, let's go back to our assignment. So the questions that you are going to answer for this assignment, you want, after you pick the study, you want to know why the study was done. So remember, I showed you where the purpose of the study, That's the purpose of the study. What is the question that was asked for the study to answer it? Hypotheses of the study, and you probably all know what hypotheses are, or hypothesis. If I have one hypothesis, is what do you expect to see after the study? What do you expect to find? Is this study relevant to clinical practice or to the real world? Am I asking a question, esoteric question that nobody cares about, or am I asking a question that is related to clinical practice or the real world? How did the author decide on the sample or the subjects of the study, and what are their characteristics? What are the outcome measures? Remember, this is very important. Outcome measures of to handle the data that they have collected. And I would like to see your answers. And I don't want you to worry too much about if your answer is correct or not. I want you to show me your thought process more than a specific correct answer. So I'm really encouraging all of you to think and to express yourself, so I can get a feel of what you know and what you don't know, so I can tailor the coming lectures to make sure that we are all on the same page. Did the results answer the question of the study, or it didn't? Many people ask questions, but then they get lost in the detail of the study, that they don't really answer the question, or the methods that they have used is not really appropriate for answering such a question. Did the authors make proper conclusions from the results? Proper conclusions, for example, if I say that I did an intervention, it increased the range of motion of a patient by 5 degrees after 3 or 4 or 5 sessions. Can I conclude that my intervention was useful? And this is where the discussion of the results will come. Okay, I improved the patient, or the patient improved because of my intervention, hopefully, 5 degrees. Is this a good result or a bad result? Patient improved, but by 5 degrees. What is the measurement error of knee flexion? And we know that the measurement error for knee flexion, goniometric measurement, is 5 degrees. So the 5 degrees could be just measurement error. It is not real improvement in the condition of this patient. So this is the discussion. I get the results. The numbers are telling me one thing, but my brain is telling me another thing, because I know that the measurement error, the improvement, must be beyond the measurement error. Okay, so these are the questions. Good luck with these assignments. I will not burden you with any more this week, because I really would like you to concentrate on these assignments. Please work in your groups. Please don't worry too much about getting the correct answer from someone. I really would like to get a feel for what you know and what you don't know, so I can move faster if these things are too easy for you. I also appreciate your feedback, so write to me واكتبوا لي بالعربي. حاسين اللكتشرز ماشيه ازاي؟ هل ده بطيء قوي عليكم؟ انتوا اوريدي عارفين الكلام ده، ولا لسه بتعرفوا حاجات جديدة؟ لان احنا محتاجين نسرع شوية. فانا بس في الاول عايزة اتاكد انكم ليكوا اكسس للويب سايت وان كل حاجه ماشيه سموث، وفي نفس الوقت انا برضو بتعلم ازاي ابلود ثينجز على الويب سايت. ف please concentrate on the work. Next week there'll still be lecture, بس ال homework is not due until the date I have indicated. Okay. ابعتولي again، ابعتولي بالعربي وانا معلش هجاوبكم بالانجليزي. و good luck to you، والسلام عليكم.